Now let's discuss when an order is actually appropriate for a CT head with contrast. We've established that there's no contrast that should be ordered if you're concerned for a bleed. So that's okay. Always a non-contrast is okay, typically. If they don't have priors, especially if they don't have priors, they should have a baseline of something to compare. So CT head with contrast. And I am not discussing about CT head for angios. So that's the arteries, and we're not looking for that at all. So for CTAs, we actually need a power injector. Cannot be hand injected. I'm specifically talking about CT head scans with contrast, and it could be power injected really slowly or hand injected, which is obviously really slow. Typically, that will be ordered if they're concerned for anything that breaks through the blood barrier of the brain. And that takes a very long time, at least 5 minutes, because it has to really go through the arteries, the venous, and then it just goes through everything. So when is it okay? First thing is there's typically 2 things that I've learned. There could be more, and if you do know more, please share. So the typical stuff that I know is cancer. So if they're thinking that it's spread to the brain, it's cancerous, then that's one thing. Because you don't look at your arteries and stuff for that. It's more of like a delayed phase. And then the second thing is meningioma, and that's like a tumor. So those are the 2 things that it would be okay to have a CT head with contrast. Another thing is HIV as well. Forgot about that one. Yeah. Just clicked to me. I'm glad it did, because I didn't want to do another video. So that's the 3 things. So tumors, cancers, or HIV. And that's a delayed phase. Typically, you inject and then you wait at least 5 minutes, sometimes 10 minutes. Every facility is different. And some facility even does it faster than that. But as long as there's a longer delay, like more than 70 seconds, because you don't want it to go to the venous, you want it to pass the venous phase. You really want it to break the blood-brain barrier. I hope I'm saying that correctly. It's like a tongue twister. So yeah, I hope that helps in deciding whether this CT scan is ordered correctly or not. And yeah, so if the doctor's concerned for those things, that should be okay to order. Again, if there's other stuff and you guys want to share, please feel free to leave a comment, and let's learn together. Okay, toodles noodles.